Orthodontic treatment is a long, protracted treatment. That's why sort of a good relationship with the orthodontist is mandatory. It starts with assessment, sort of very careful assessment by taking x-rays, scans, photographs, doing detailed measurements of teeth and the face, as well as the skeletal structure within the face. We then give the patient options. There are many braces out there, ones that show, ones that do not show. The most famous are of course the metal ones, but there are many forms of braces that people can have inside and outside their mouth as well. So aligners are new technologies based in artificial intelligence. So basically we take a scan of your teeth and send it away to the companies, and the companies align your teeth sort of using computer generated designs and manufacture these pieces of plastic. Okay, so what you get is multiple pieces of plastic that you have to wear in a serial fashion over time, and that's how your teeth straighten over the period of treatment. Okay, there is quite a lot of planning involved, but not so many appointments are required at the orthodontist, and not so much invasive work essentially. So these are metal, the classic metal train tracks, but where they're different is that they don't have bands around them. Classically, bands increase friction and put a lot of force on teeth. These do not have that. So they have a little door that we flick open and we press to close. A lot more comfortable. They are a lot more aesthetic, so they look a lot nicer and people like them, especially adults. But it's a different technology to what we used to use before. It doesn't hurt, but it can be uncomfortable in some people some of the time. Naturally, the younger you are, the more tolerant you are to braces or to anything in life. The older you are, sometimes takes or might take you a little longer to get used to a brace. Nothing that a paracetamol would not take away pain-wise. Orthodontic treatment ranges from monitoring a young patient to more invasive treatment, and it can be, for example, if we have a buried tooth, we may have to resort to surgery to get that tooth out, but on the whole, it isn't. It's just fitting braces on teeth and literally sticking metal braces with dental glue, essentially. So when you have a brace, of course, your day-to-day life changes a little bit, but nothing drastic. So you have to be mindful of what you eat. You have to be mindful that there is something very fragile doing a fantastic job in your mouth. And it's a bit like having a kind of an expensive toy or an expensive appliance that you need to look after. If you look after it, it will look after you. But it is an appliance and it needs to be looked after by yourself, by the professional as well, and mostly by following instructions that the orthodontist will go over with you in great detail. Index of orthodontic treatment need describes a grading system, with 1 being mild and 5 being severe, requiring more than one specialist. Okay, so the grading system is essentially a filtering system for the NHS, meaning mild cases are usually not treated under the NHS, and severe cases will be treated at no expense to the patient. However, there are long waiting lists, of course, as there are many people waiting for the treatment and not enough orthodontists to treat all of them, leading to these long waiting lists. Anyone can have a brace if they need it. Your dentist will examine you and decide if you need one. If you do, it is down to you to find an orthodontist, and usually this is self-funded if it's a mild case. If it's a severe case, this can also be done on the self-funded route, but your dentist may want to refer you to the sort of an NHS provider where it can be done for free. We're really nice people here. I think we care. We care about, your teeth. We care about how you feel. We engage with people. We make sure that we kind of deliver time and time again. It isn't just about orthodontics. It's about your smile. It's about your confidence, and it's about connecting us with you, you with the world. We know that waiting lists can have a detrimental effect on a child's well-being. Here at the Dental House, we offer a 0% finance so that people can access treatment and access it quickly. Ideally, children should be treated early and should be referred to us orthodontists as early as possible so we can prevent future problems. But a lot of people did not get that chance when they were younger, and a lot more people are attending the dentist inquiring about orthodontic treatment, meaning we're doing a lot more adult orthodontics. We are combining it with aesthetic dentistry, so we kind of looking after your smile rather than your teeth, helping you with your confidence.